Hi, my name is Cheryl, and I want to share my cancer journey with you. I was 48 years old when I found a lump on the right side of my neck. I wasn't sure what it was, so I went to see my family doctor. He, he examined me and he thought maybe it was a virus and give it a month or two and let's just see if it would go away. Well, I wasn't quite satisfied with that answer, so a couple weeks later I called my doctor back and asked him if we could just get a CT. It would ease my mind. So that's what we did. I had a CT and it came back as a mass. So the next step was to get a biopsy. I had the biopsy done and it did come back P16 positive squamous cell carcinoma. I knew it was in my lymph node, but I didn't know where else in my body it had come from. So I ended up needing a PET scan. The PET showed that it originated and the primary was in the base of my tongue. At that time, I didn't know anything about P16 positive or HPV related. All I really did know was that the virus could cause a common cancer, which is cervical cancer. In fact, years ago, I had my daughter vaccinated when she was 11 years old with Gardasil to make sure that she wouldn't grow up and have to worry about cervical cancer. Other than that, I did not know about it causing throat cancer or penile cancer, anal or vaginal cancers. And I am actually a nurse and I didn't have any idea about that. So I educated myself very quickly. I proceeded to see surgeons, radiation oncology, and medical oncology. The surgeon did scope my throat and basically told me that I was not a surgical candidate, so I could not have this removed. I did, however, have chemotherapy and radiation simultaneously. This was over about a 2-month period. I went every day for radiation treatments, 5 days a week, and I had chemotherapy through a port every 2 weeks. It was a rough treatment. At the beginning, it went okay. I immediately lost my sense of taste. I couldn't taste any food. My mouth got dry and I was very fatigued, but able to handle it overall fairly well. A little over halfway through though, I hit a brick wall. Everything went bad. I called my doctor, had told him I hadn't ate or drank anything for several days. I couldn't swallow, the pain was horrific, and something needed to be done. He then put me in the hospital. He put me on TPN, nutrition through my veins, and had a feeding tube placed. From then on, throughout my treatment, I was getting 24/7 feedings through my feeding tube. I ended up being in the hospital for a couple weeks, and my treatment had to be put on hold. But I did finally get out and was able to finish treatment. Although I don't remember a whole lot of it. I was on a lot of pain medication due to the severe pain in my throat. I did a lot of sleeping through my treatment. But I did get through it and completed it, and I am now a 3-year survivor. Through all this, emotionally, it was very hard. The day I was called from my doctor and he told me that I had cancer, it was a shock. When I found out it was throat cancer, I was very shocked. I had no idea I could get something like this. My family, my children, they were all shocked. I had to tell them we had to deal with this. I didn't know if I was going to live. I didn't know. I had to face my own mortality. It was very hard. Did I have 1 year to live? Did I have 2 years to live? Was it curable? I didn't know. These were all things that were a huge question mark. So emotionally and physically, it was hard. It was also hard financially. I couldn't work. There was no way I could go to my treatments, and with the pain and fatigue, not to mention my blood counts, I think I had a hemoglobin of 7 through my whole treatment. I was dizzy, I was lightheaded, and I was so tired. There was no way that I could work through this treatment. Thank goodness my husband did work, but we were down to one salary, which was hard to do at the time. And I wasn't able to go back to work right after treatments because it took me a while to get back to a somewhat normal sense. Through this whole experience now, I have been in remission for 3 years, and it hasn't been over by a long shot. I still emotionally worry every day that either the cancer will come back or it will reoccur in a different area in my body. I worry about my family. I worry about my children. I worry about many things that are out of my control, but I don't know what my life is going to hold. I still experience a lot of side effects. I don't produce saliva, so I have to take medication every day. I still can't taste most foods. I eat because I have to eat, but if I do find a rare food that I can maybe taste a little, I stick with it quite a bit and eat a lot of it. I still have some neuropathy in my hands and in my legs. I have ringing in my ears from the toxicity from the chemo, and I am losing my hearing. And I've been told we'll need hearing aids in the near future. All these side effects, the emotional distress, and the financial distress that I experienced before treatment, through treatment, and now 3 years after treatment, all I can do is think that this could have all been prevented by a simple vaccine. That vaccine is now available to our children. I am asking for a call to action. I am asking for you to talk to your patients, talk to the parents about getting their children vaccinated, talk to them about the risk of cancer. It is very real. I would have never in a million years thought I would be sitting here talking to you about this. Please educate your patients, educate your friends, educate your family, and let them know that these cancers are preventable. Our children do not have to go through what I went through. I am very thankful that you listened to my story. Bye-bye.